For the extended ankle point, you're going to find a tender point either up here at the proximal end of the gastroc or down along the Achilles. Up at the proximal end, you will then palpate both the medial and the lateral heads of that gastrocnemius along the popliteal line. So I'll come down along here, then I'll take my thumb and I'm going to push straight into the tissue. That's the medial side. The lateral side, I come down along that popliteal line, feel that tissue, and I'm going to push straight down. Again, I'm looking for a thickness, a fullness, or a painful response from the patient. In addition, for this one, you can also find tender points in the middle section of the Achilles on either side. So first I'll go medially, and I'm going to push into the Achilles. Then laterally, again, pushing into the Achilles. Once a tender point's located, now we'll go right to treatment. For the extended ankle point, you'll bring the person into knee flexion. I'm going to bring my leg up onto the table. Then I'm going to take her foot and put it on my thigh, kind of resting her foot into the pocket area of my pants here. Once I do that, I can actually secure the hold of her foot in my thigh and leg area here. When I do that, if I just lean back, I actually cause her foot to go into plantar flexion. For her, we'll pretend that she had a tender point on this lateral aspect here. So I'm going to put the foot, I'm going to grab hold of this calcaneus, I'm going to lean back so that I cause the foot and heel to go into plantar flexion. We need to have internal rotation of that tibia. And then once I do that, I'm going to lean back. And when I lean back, it causes a traction motion on the entire leg. When I monitor the tender point, I have to be careful to what? Remove my pressure. So I'm not creating an input there, and I'm just palpating to see the tissue relax and to see if the patient has no pain. While I'm holding there for that 90 seconds, I can recheck by pushing again. How does that feel? Okay? When you treat the tender point, you'll hold it for 90 seconds, being careful not to have pressure on the tender point, just monitoring. Once 90 seconds is complete, you will slowly return the person back to neutral position. Then we repalpate. Medial aspect, pushing straight down. Lateral aspect, pushing straight down. I want to see if that point is at least 70% better. And then we check the tender points on either side of the Achilles tendon.